Oh, sorry, don't say.
Horrible, can't you tell?
I'm so sorry to hear that, sir. We're going to try to get you out of here as soon as possible. So I guess you can just go home and relax. Have you filed with us before?
Yeah, I have.
And can you tell me your first name and last name?
My name is Joe Johnson.
Okay. Looks like I found you. Can you just verify your date of birth for me, please?
It's 2/14/1986.
All right. Thank you, sir. Let me just put your medication inside the system.
How long would it take?
Oh, it shouldn't take more than 15 minutes if it goes through the insurance.
15 minutes? That long?
Yes, sir.
I just spent 2 hours at the doctor's office. I'm sick. I want to go home. I have a fever. Why so long?
Like I said, sir, I'm so sorry to hear that, but we're going to try to get you out of here as soon as possible. Looks like I put your medication in, and actually your insurance just rejected it, and it's telling me that it requires for you to use an alternative medicine. And if you actually want to purchase this medicine, it's going to cost $154 in cash price.
$154? I just spent.
Correct, sir.
That's outrageous. I just spent $40 on my co-payment at the doctor's office. Why so much? Why would he prescribe something so expensive?
I'm sure you just didn't know that your insurance wouldn't cover it. But yes, the medication is expensive, but it's actually very good at treating the current symptoms that you're experiencing from the bacteria that's causing this.
There has to be something cheaper. There have to be alternatives.
That's correct, sir. There are a few alternatives.
Okay, what are they? Can you switch me to them?
I sure can, but I'm going to have to actually call your doctor and get her approval from him. It should take like 5 to 10 minutes if he's not busy.
Call the doctor? Aren't you a doctor? Can't you switch them to me? Why do you have to call him?
Sir, I'm trying to resolve the situation in the best way I can. And no, there are laws that prohibits me from doing such things. I have to follow them to make sure there are no errors that can cause threat to your life.
Oh, I guess. Go ahead. Do what you gotta do. Hurry.
Alright, sir. Well, if you just sit down in the waiting area, I'll call you as soon as I'm done speaking with the doctor.
Hello, this is the nurse speaking. How may I help you?
Hi, how you doing? This is Levaquin calling from Good Neighbors Pharmacy. I have a patient here that just left your office. His name is Joe Johnson, and his date of birth is 2/14/1986.
Okay, how can I help you with this patient?
Well, can you actually transfer me to a doctor? I want to speak to him personally.
Okay, one moment.
Thank you.
Hello, this is Dr. Smith. How may I help you?
Hi, Dr. Smith. This is Pavel calling from Good Neighbors Pharmacy. I have a patient here that just left your office. His name is Joe Johnson.
Ah, Joe Johnson. Yes, I remember him.
All right. Looks like you prescribed him one of the medication, which is Avelox, and the insurance actually does not cover it. I wanted to see if you want to switch it to something else.
Okay, what do you suggest?
Well, my suggestion is to change Avelox to Levaquin 500 since it's in the same class, and the medication actually comes in generic form also, and it should be the same directions, which is 1 tablet by mouth daily for 7 days.
Okay, let's go ahead and do that then.
All right, thank you, sir. You have a great day.
Same to you.
All right. All right, Mr. Johnson, can you come over here, please? All right. All right, Mr. Johnson, looks like the doctor has approved to change your medication, and if they go through with insurance, and the copay is $15.
That's what I like to hear.
All right, while my technicians are actually filling medications, I wanted to go over with you about the direction and side effects of this medication.
Oh, my doctor already went over the directions. I don't need any counseling on this one.
All right. Well, really? So you know what new medications you'll be taking and how you're supposed to take it. And actually, it will take 5 minutes for my technicians to fill in medication, so it just wouldn't hurt just to hear a few things about it.
Oh, I totally forgot that it was a new medication that got switched. Yeah, I'm sorry, I'm sick. I'm agitated, impatient. I just want to get out of this place.
No problem, sir. Like I said, we'll try to get you out of here as soon as possible. All right, your doctor authorized to change your medication to Levaquin, but which is the same class of medication, and directions are on it actually the same as before. So we actually take 1 pill a day for 7 days with a full glass of water.
Okay, my doctor actually told me to, I'm pretty sure he said to just take it until my symptoms are gone, the cough and the chest congestion.
No, not at all, sir. You must finish your treatment even though your symptoms might be gone in the middle of treatment, because your infection might come back and it might get worse, and it could be harder to treat if you would actually stop in the middle. So you do have to take it to 7 days and finish your medication.
That's good to know. I would have just stopped it after my cough went away.
No problem, sir. Like I said, it's our job to make you to take the medication properly. Alright, there are also some things you need to know while taking this medication. One is that you need to avoid vitamins and any products that contain aluminum, magnesium, zinc, iron, or heavy calcium, like milk, for instance. And if you actually are taking such products, give a 2-hour window between your medication.
Oh, okay. That's good to know.
Alright, and are you currently taking any other medications, like over the counter or any herbals?
No, I'm not.
Alright. And I also noticed that you said that you have a fever, and I wanted to know what do you usually take when you have a fever?
For my fever, I usually take the ibuprofen. Ibuprofen is, what I use. It usually works.
Alright. Well, definitely when you take Levaquin, I suggest that you stop taking ibuprofen and actually buy Tylenol, since taking ibuprofen with Levaquin can cause seizures. And also, the most common side effects of the medication, which is nausea, vomiting, and diarrhea. And if you would experience such problems, take it with food, but again, don't take it with foods that will contain aluminum, magnesium, zinc, iron, or calcium. And if you get a severe rash, make sure you stop taking medication and call your doctor right away to see if he can prescribe you something else to treat your symptoms. And watch out for any, monitor your heart, and the drug may cause any irregular heartbeats. So if you get 5 to 10 irregular heartbeats in an hour, stop the medication and call your doctor also. And also drink plenty of water throughout the whole day. And if you do go outside, try to put some sunblock on your face and any skin that is exposed to the sun, because the medication makes your skin more sensitive to sunlight.
Okay, all those things are good to know. My doctor didn't go over any of that, so thanks for telling me.
I'm sure the doctor was just busy. Alright, it looks like your medication is ready. Let me bring you out. Here you go, sir. And can you just go over with me about the directions and what you should be avoiding again?
Okay, you take the Levaquin once a day.
Right.
You avoid any foods or supplements that will have magnesium, calcium, aluminum. You switch from the ibuprofen to the Tylenol for my fever.
That is correct.
So, and stay away from milk as well.
That's right. All right. Sorry for any delay, sir, again, and I hope you feel better and you have a great day, Mr. Johnson.
You too.